for you, this is, I am not a Medicare supplement or Medicare Advantage insurance salesperson. I have no interest in selling any policies to you. This is purely an educational lecture on the basics of Medicare, and it's not meant to help you decide what advantage or supplement plan that you'll get with your UCSD retirement when you reach 65. This is to give you a background of the things to think about when it comes to making your Medicare and long-term care decisions going into retirement. And to give you a background and or an idea of the expenses and costs associated with Medicare. So again, I would encourage you, as many of you have probably experienced, giving a presentation on Zoom versus being there in person is very difficult because I'm looking at the slides as you are looking at them. I would encourage you, if you have a question, to unmute yourself. You all have the ability to unmute yourself. Please feel free to interrupt me. It is not rude whatsoever because, again, most of your questions that I do end up answering are ones that maybe someone else had that just didn't want to ask that. If you prefer a different method, you can also use the chat button up at the top of the Zoom there and enter a chat because I do get a notification when someone has entered a chat. I will provide my email at the end of this. It's also listed here on this starting page. And I believe either Ariana, thank you for the lovely introduction, or Vanya will be adding this presentation to the YouTube channel. So you can always go back and either look at this one or a previous one. On a side note, I just a plug for future presentations here over the next couple of weeks. On Friday, I will be doing Advanced Social Security at same time, same place, same YouTube channel. Noon on Friday, we call it Advanced Social Security or Social Security Part 2, where I do a 10-minute review of Social Security basics, and then going to go into some of the specifics, claiming strategies, rules of thumb, things that you probably want to think about as you are making your Social Security decision as to when you will take Social Security and what's the best for your family and or for yourself if you happen to be single or widowed. All right, that being said, next week also we will be doing the investment interest group the fourth Tuesday of every month, do a lecture that is decided by you as the audience with inputs to Vanya and her team. If you have any specific things that you would like me to cover in the world of finance, that's my primary job. I provide a presentation. It's been in the past anything from AI to annuities, from option strategies to understanding bonds and how interest rates and bonds work together. So anything that you have, we're happy to give a presentation. I build them out custom for the UCSD group. So please provide that feedback if you don't mind to Vanya and her team. And then I'll put together stuff for you for the spring. Since this month, we're going to be going over elections and what the consequences of different policies regarding elections could or could not be, depending on what happens in not only the presidential race, but in both the House and the Senate. I always keep it apolitical for any of you that are very passionate about politics. I like to stay very right down the middle, apolitical, but I do like to give the financial ramifications. And we'll be discussing that. That's kind of a trick for Vanya there because normally in October, I review the 403B, 457 from an outsider's point of view, not the Fidelity point of view. But I'm going to move that to November. And in October, I will be doing because of course, the fourth week of Tuesday in November, the elections will be over and it'll be in the rearview mirror. So I figured it'd be more prescient to do it in October and then save November for the different retirement plans and the qualified pension that you are entitled to as a UCSD employee if you have qualified. Okay, that being said, let's get into Medicare without any questions. I'll jump right into it. 3 key points in Medicare. One thing also, I'll just warn you ahead of time, as I sit here in my office, I do tend to speak fast. So if I am speaking too fast, I know I have some usual suspects out here joining us today. I bet Christine will tell me, Chris Wright will tell me, excuse me, if I'm speaking too fast. Please do, because I tend to speak very fast. 3 key points on Medicare. First and foremost, if you do not enroll in Medicare on time, you are going to pay a monthly penalty. I'll give you a hint. That penalty is up to 10% per year for your Part B and your Part D if you are not enrolled on time. So you want to make sure you are enrolling on time. Second key point, if you do not get the right private insurance to go with your Medicare, you may pay too much in premiums or out-of-pocket costs. Remembering that Medicare is not simply a government program, it is a government private insurer partnership. You have a partnership with the government, and you have the private sector that is in partnership with the government, creating what we call Medicare. Third, if you don't plan for higher health costs in retirement, you could run out of money. Most of you, I don't think, will have that issue because you do have pensions and potentially have access to Social Security, which both have a great inflation protection. But I will describe some of the potential ramifications of different costs around Medicare, just so you understand and plan for them ahead of time. All right. Here's our agenda. Part one, we're going to talk about what is Medicare, who needs to enroll in Medicare and when, and how do you enroll in it. Part two, we're going to talk about how much it costs, what does it cover and what does it not cover, and how does the private insurance work with Medicare. That's going to be our second part. And pardon me one second. Oh, thank you very much. Yeah, I was just delivered my reading glasses, which I happened to drop in the lake here on our fall break with my children. They work perfect. Thank you. That's fine. Yeah, thank you. And I dropped my reading glasses in the lake, and my new ones just arrived. So I can now actually see the presentation, which I couldn't do about 2 seconds ago. I was doing it by memory. All right. And part three, planning for higher health costs. A couple reasons your healthcare expenses will be higher in the future. Of course, inflation, and then the increase in the need of services as you age. And then, of course, what does Medicare not cover? And I think most of you probably know this by now. And there's an excellent presentation that Ariana can discuss at the end of this that is done, I believe, in the fall and the spring. It used to be done by Jody Hubbard, but I know it's someone else now that does a long-term care presentation. I will mention a couple new things that have come out in the long-term care world that may be of interest to you, but I'll get to that towards the end of the presentation. All right, so let's just look at healthcare inflation in the United States. I took a snippet the last couple of years. I don't have the 2024 numbers because we're not done yet. 2023 numbers I did not have as of this presentation. I'm sure they're coming out here in October with the Social Security trustee report. But over the last couple of years, despite headline inflation being extremely higher, or not, I won't say extremely higher, particularly in 2023, you can see it certainly rose in 2022. And in 2023, I would expect a significantly higher number. But over the course of the last, let's call it 10, 20 years, healthcare inflation has significantly outpaced the consumer price index, which is what we use for inflation for all goods. Something to think about as you think about how much money you need set aside for your healthcare and retirement. All right, so part one, Medicare enrollment. Who pays for healthcare in the United States? Well, before age 65, for those of you that are UCSD, either retirees, emeriti, or you're currently at UCSD, you know that you have your employer group health plan, which is a great plan here at UCSD. If you retire ahead of time, meaning ahead of time prior to 65, you have the retiree benefits at UCSD. And then at 65, of course, you're going to sign up for Medicare as a primary payer. For those of you not with UCSD, if there's anyone that's not, you have COBRA, which is when I left Morgan Stanley, I had COBRA for a little bit. That just stands for Consolidated Omnibus Reconciliation Act of 1984, 85, or 86, somewhere in that range. And so it's just an acronym for a law that came out of Congress, and that just extends your healthcare benefits up to 2 years. And then you have the individual health insurance and the exchanges. The other down there at the bottom, an example of other would be what I have as a retiree from the United States Navy. At 60, I have what's called TRICARE. And so there are other forms of insurance out there. Some people have a company-sponsored health insurance that goes throughout Medicare, like you do at UCSD, and some people do not. So there's some other different types of insurance out there as well, not associated with the ones that we traditionally think of. After age 65, Medicare pays first. That's part of the public-private partnership, meaning that age 65, everyone, except for a small carve-out exception, are required to sign up for Medicare. This means everybody's in the pot together. And that assumes that you qualified for Medicare, which is qualified through your Social Security benefits. There is an exception, and that's for what's called creditable insurance coverage. And creditable insurance coverage is defined by an employer group plan with 20 or more employees. UCSD happens to have creditable insurance coverage. But my understanding from UCSD is they do still want you to sign up for Medicare as your primary payer, and then they pick up most of the rest. And then your other insurance, which would be UCSD in your case, or most people's case on this presentation, is the second. What this means for you, again, if you're not covered by that creditable insurance, when you turn 65, you must enroll in Medicare. And what if you don't enroll in Medicare in time? I mentioned this in the beginning. There's potentially a penalty. That penalty on your Part B and D premium, 10% per year that you don't sign up on time when you're supposed to. That penalty is a lifetime penalty, and it doesn't go away, and it only compounds if you continue to wait. Your healthcare expenses may not be covered by insurance if you don't enroll in time, and that has more to do with the Medicare Advantage and Medigap plans. And your private insurance options may be limited, meaning you may not be able to enroll without pre-existing conditions if you don't enroll in time. All right, so what is Medicare? Developed 1965, National Health Insurance Program, people 65 and over. For those of you that are familiar with their FICA taxes, right? You have the OSDI insurance taxes, which is old age survivor disability insurance. That stands for Social Security. That's the 6.2% that comes out of your paycheck, and your employee matches that. And then you have 1.45% that comes out of your paycheck, unlimited, meaning it does not stop at a certain income level. If you make $200,000 a year, you pay that 1.45% on up to $2,000, and that's HI, which is your health insurance. And that started in 1965, and it's administered by the Centers for Medicare and Medicaid Services. And of course, all the enrollment goes through the Social Security Administration or the SSA. Who's eligible? Everyone over age 65, all U.S. citizens, and then legal residents, legal being the primary word there. Legal residents have lived in the U.S. continuously for at least 5 years. Some people under age 65 are eligible for what are called disability benefits or disability Medicare. That's predicated on if you're eligible for disability insurance or Social Security, and that's a totally different subject that I won't cover today. Okay, 4 parts of Medicare. This is where the confusion begins, so let me see if I can unravel some of this. All right, you have Part A, which is HI, which are hospitalization insurance. Your Part B is your doctor's visits, inpatient care. And then Part C is what's considered Medicare Advantage, which, as you can see in the descriptions up above, includes Part A, B, and usually a good Medicare Advantage plan also includes your prescription drug plan as well, which is known as your Part D. Separately, Part D is known as the Medicare prescription drug coverage, right? Again, C and D are provided, and the Medigap, which we'll discuss in a second, or Medicare Supplement, which is also known as, are the private part of the partnership, and then parts A and B over here are the public parts of the partnership. All right, so if we look at it graphically, if we look at it going down on the 2 different options, you can see over on the left side, we have original Medicare, which is option 1. You have Part A and B. You add on a prescription drug plan, a PDP, which is Part D, and then you add your Medicare Supplement insurance, which is also known as Medigap, just gapping the insurance. We're going to go over here in a second what that covers. And then you have the non-original Medicare, which is Medicare Advantage, which is Part C. And these can be plans like HMOs or PPOs, and typically include A, B, and D. The example I always use is Kaiser. That's going to include your Part A, B, most likely, if not always, your prescription drug plan, and many facets of what a Medicare Supplement or Medigap plan, all bundled in one. Typically, I see people that were on a Medicare Advantage plan prior, or excuse me, Advantage plan, or excuse me, a plan like a Kaiser plan prior to 65, stick with the Medicare Advantage plan. And those that had a different type of plan, like the high limit plan at UCSD, tend to go with some type of supplement. I will say the big difference is neither of these can you be denied for pre-existing conditions upon your initial enrollment, but subsequently each year as the plans change, premiums change, and benefits change, the Medicare Advantage can never deny for pre-existing conditions, but Medicare Supplement plans, specific ones, can after the initial enrollment. Just remember that. All right. How do you enroll in Medicare? So if you're receiving Social Security benefits, you turn 65, it's automatic. A and B are automatic. A, you get free if you've qualified for it. B is the premium that will come out of your Social Security benefit, including what's called the income-related monthly adjustment, which I'll go over here in a second. Coverage starts on the first of the month, the day you turn 65, unless your birthday is on the first of the month, and then it's the month prior. Part C and D are not automatic. That's where you must choose a private insurance and proactively enroll. If you leave with nothing today other than this, I will tell you that Medicare is one of those things that needs to be updated and thought about each and every single fall that you are alive for the rest of your life. You need to consider the different facets of the plans that you have, what their benefits are, what prescriptions they provide, what your medical conditions are, if you have any. Hopefully nothing serious, but if you do have something, you want to consider that in the context of what you're looking at for a supplement plan or an advantage plan. That's probably the single biggest takeaway from this presentation is it is incumbent upon you to be proactive each and every year. Find a good Medicare supplement or Medicare Advantage agent that will give you all the different changes and the things that have occurred over the years and get you into the right plan. I do not do that for a living. That's not part of my purview. So that, again, that's why I said at the beginning of the presentation that this is simply for information purposes only, not to sell you anything. So you must sign up to the Social Security Administration during a Medicare enrollment period. There are 3 different periods. There's the initial enrollment period, there's a special enrollment period, and general. Let's go over those. If you're not automatically enrolled in your 7-month initial enrollment period, right? So here is the time that you want if you turn 65, let's say you're retired or you're retiring at age 65. This is the time you want to apply for your Medicare benefits, or you want to sign up via the Social Security Administration, right? 3 months prior is the best, 2 months prior is the next best, 1 month prior is the next best. And that means you'll have no delay. The month you turn 65, my birthday is November 26th, so I won't be 65 this year, a couple of years younger than that. But if I were to sign up on Medicare, hopefully I would have already done that in August or September or even October. That way my benefits would not be delayed and I'll start on the 1st. If somehow this slips by you, or maybe you're sitting here and you're 65 in 1 month right now, you have not signed up, you need to get going because you have 3 months after for a delayed start. And the coverage will be delayed. It will start the month after you sign up on the 1st of that month, but you need to hurry up and get done to avoid that penalty. Who signs up for Part A during the initial enrollment period? Pretty much everyone who turns 65. If you're UCSD, you will be doing that whether you're retired or currently active and still working. Check with your benefits administrator. Highly encourage that here at UCSD. You've got great administrators that know this backwards and forwards, and I know you have a presentation that goes over the specific plans at UCSD as well. One thing I'll caution for those of you that are not in the UCSD system, don't sign up for A if you have an employer plan that has creditable insurance and you have an HSA, because you cannot contribute to an HSA once you started Medicare. Question I always get, can I use my HSA for Medicare premiums if I'm not collecting Social Security and I want to pay for them out of something that's tax-free? And the answer to that is yes, you can use your HSA to pay for Medicare premiums or supplement plan or advantage plan or prescription drug plan. Who signs up for Part B during the initial enrollment period? Well, people who are not covered by comprehensive employer plan, the credible coverage as I discussed, people that are not working, self-employed, employed by a company less than 20, on COBRA, receiving retiree health benefits, or employed with a company whose health plan is less comprehensive than Medicare. So that would require you to sign up for Part B right away, when you turn 65, I should say. Same thing for Part D. You must either have creditable coverage or first eligible. There's 2 options for Part D. There's the standalone plan, as I mentioned earlier, or a plan that is encompassed within Medicare Advantage plan. All right, so special enrollment period. Remember, there's the initial enrollment period, which we just discussed, which will pertain to 90% of you. Then there's special enrollment. Special enrollment's people that did not sign up for B and D during their initial enrollment because most likely they were covered by a plan with 20 or more employers. I won't cover this much because most of you are UCSD, if not all. But if you have a spouse that works at, say, Qualcomm or something like that, and they're working till 68 or 69 or maybe even 70, they have creditable coverage and they won't need to sign up. So they'll go to the special enrollment period. Best thing, just like initial enrollment, is to sign up before your retirement. Get it all set on automatic. If not, you have any time before your coverage ends on both Part B and D. You have an 8-month period following separation from employment for Part B and 63 days for Part D. Why that's different, I have no idea. That was done by Congress and all their wisdom. But the bottom line is you need to be signed up by 63 days or face the penalty within Part D, or 8 months and face the penalty within Part B. All right, so best time to enroll to avoid late enrollment penalties, sign up during initial or special enrollment period. If you don't, there's called the general enrollment period. This is for people that completely missed it, fell asleep at the wheel, as they say, and did not sign up during their initial or special enrollment. You sign up during the general enrollment period. I call this the penalty box, January 1st to March 31st. and then your coverage will begin on July 1st. There is a significant gap there, as you can see, between when coverage is signed up for, as late as March 31st, and when it begins on July 1st. So do not put yourself in the penalty box. Please sign up for Medicare on time. Just a quick review: initial, special, and general enrollment. I went over that in ad nauseam, so I'm not going to go ahead and belabor the point there. Plus, this is a long presentation and got a lot to cover. How do you apply? Simply go to that SSA.gov, push on that button, apply for Medicare benefits, or call SSA, or you can go to Medicare.gov. Simple enough. And then once you are on there, you're going to sign up for Medicare Part B, or excuse me, D, and you're going to decide if you want original Medicare, which is A and B, and the Medicare supplement and prescription drug, or you're going to say that, hey, I'm doing a Medicare Advantage plan that's going to cover that, and I don't need a prescription drug plan. All right, so part one's over. Any questions there? Anything that I didn't cover or went too fast? Wait for a second. Anyone? You can unmute yourself if you'd like, or if not, enter in the chat. Okay, great. Part two then, Medicare and private insurance. So premiums are nearly half of Medicare beneficiaries' out-of-pocket spending. This slide's a little old. It's about 7, 8 years old, but I don't think much has changed over the years. Services account for roughly 60% of what comes out of the pocket of a Medicare beneficiary, whereas premiums are only about 40%. So everyone gets worried about all this money they're going to pay for premiums, deductibles, all these other things, but it's services that tend to be the most. And that's why it's really important to understand what your policy covers and doesn't cover, and to make sure that it's covering the right things. The out-of-pocket costs, let's talk about that real quick. First and foremost, we have premiums. We have the Part B premium paid to Medicare. Got news, we got Part D premium as well. We have a private insurance premium for the Part D drug plan, plus Medigap policy, or if you're doing the comprehensive, the Medicare Advantage plan. Other out-of-pocket costs other than premiums. Remember, premiums is what you're paying automatically, B and D, on the part of the public partnership. The private partnership, you potentially have deductibles. Portion of the doctor bill is not covered by Medicare, and services not covered by Medicare, right? We're going to go over those here in a second. Here are the monthly premiums. Part A is 0 for most, if not all of you. For those of you that have less than 40 quarters, which is 10 years of work history here in the United States, paying into Social Security, you potentially have that $270 a month or $505 a month. That's if you have 30 to 39 quarters or less than 30 quarters, okay? Most of you will be 0, so you're not going to have a premium in Part A. Part B, every single one of you is going to have a premium in Part B, and as of 2024, it's $174.70 a month, plus an income-related monthly adjustment, which I will refer to from here on out as the IRMA, income-related monthly adjustment. Part D, you pay to private insurer, varies with the plan, plus the IRMA as well. So what is the IRMA? This is the one that I often get, wow, I pay so much more in my my Medicare Part B and D than I ever thought, and I didn't even make that much money last year. Well, your IRMA is determined by your tax return from 2 years ago. So if you have an IRMA in 2024 that's on top of that 174 and on top of your Part D, right, it's based on these married, filing joint if you're married, or single modified adjusted gross income amounts. Let's just say you sold a home in 2022 here in Southern California, and let's say you bought that home when you started UCSD in the late 80s, early 90s for $250,000. And you sold it for $2.5 million. And you took your $500,000 exclusion, you put some money into it over time, but you had $1 million capital gain, right? So you got 500 exclusions, you have 500,000 capital gains. That 500,000 goes on top of whatever your income. Let's say your pension income and all this other stuff is 120,000. So now you're at 620,000 in modified adjusted gross income for 2022 because you sold that home. You are going to have this 384.30, that 384.30 in the Part B on top of that 174.70. And your Part D, you're going to have another 74.20, right? So it is a significant amount that you may not be thinking of if you have a large capital gain asset that you're selling. And this is one of the things I often tell our clients as they're going to retirement. You know, we like to do the planning 5 years out because we like to think about this specific thing, because there's nothing you could do about it once it's in your tax return 2 years ago, right? You have that IRMA and you're going to pay it. Another thing I often see is someone that has a large brokerage account or trust account, and they're trading stocks and doing all this stuff because they love doing it for whatever reason, right? They don't think about the tax implication of that. Well, first of all, you're in the state of California, the most progressively taxed state in the union, so you're giving up a lot of those returns if you get them anyhow. But secondly, and most importantly, what you're doing is you're adding to modified adjusted gross income and potentially increasing the amount you're paying in Medicare on an annual basis. And recall, this isn't just the income-related monthly adjustment for one beneficiary. If you're married, this is for both of you. So potentially an extra $400 a month or more times 12, that's almost $5,000 annually. It is $5,000 annually. Actually, if you take that bigger number there at the bottom, $750,000 or more. So 500 times 12, or excuse me, 419 times 12, roughly 5,000 times 2 is 10,000. That's 10,000 extra in just Medicare Part B premiums. Now add on Part D. So you can see that IRMAA makes a difference. And if you didn't think Medicare was means adjusted, it certainly is, and this is your proof. All right, moving along. 2024 deductibles. This is the amount you'll pay in deductibles. And of course, this is what we get a Medicare Advantage plan for, or a Medigap plan, is to help us with these deductibles. Part A, $1,632 per spell of illness. Part B, $240 a year. That's waived for some preventative services. Part D, $554 a year. And then we have coinsurance. So we have premiums, we have deductibles, and now coinsurance. All right, coinsurance, Part A, hospital $408 a day for days 61 through 90, 0 through 61 is 0, by the way. $816.91 through 50. And if you have to go to skilled nursing or skilled nursing is required, days 21 through 100, $204 a day. After that 100th day, you're out, and they're going to force you to either be taken home by family or send you to some type of facility that you probably aren't looking forward to going to. I have a question. Is the IRMAA for just 1 year, or would it readjust each year? It is just for 1 year. That is correct, Yuki. I apologize if I'm saying that incorrectly, but you are correct. It is for 1 year, and then your tax return in 2023 would determine your IRMAA for 2025. Excellent question. Thank you for that. Part B is your assigned claims, 20% of your Medicare approved, unassigned, 20% approved at the rate, up to an additional 15%. All right, so this is coinsurance, mind you. This isn't premiums. This is not deductibles. It's simply coinsurance. These are things that we get Medigap plans, Medicare supplements, as they're also known, or Medicare Advantage plans for, to help us with, to mitigate the cost of some of these things. Your Part D coinsurance in 2022, individual plans vary, right? Understand a drug plan, beneficiary pays $554 deductible. Then you pay that 25% of drug costs after deductible. Small copayment once out of pocket until spending has reached $7,400, right? That's what they call the donut hole. And then once you're over $7,400, usually it's called catastrophic, and most plans will cover anything above that. But they vary widely, so make sure you are doing the research on the drugs that you're taking, or supplements, or whatever you're taking, that they coincide with the plan that you have decided, or that they have a generous allowance or allotment for the particular medicine you're taking. Again, if you take one thing away from this presentation today, one thing at all, other than I now need reading glasses in my late 40s, is that you absolutely need to do your research each and every year on what plan, or have a trusted advisor, not on the financial side, but someone that knows their Medicare Advantage plans, or you have wonderful resources at UCSD, and I highly encourage you to use them. So what Medicare covers: hospital, 100% of the first 60 days. Medical service, again, it's that 80%. We talked about the other 20%. And some preventative services, right? Flu shots, certain screenings. What does it not cover? My mother's from Mexico City. She was born and raised there. She was naturalized in 1992. She now lives here. I'm actually located today in Dallas, Texas, in, of all places, my father's office. Visiting here for fall break for my kids. We're at the lake house all weekend. But my mother, being from Mexico City, she wanted to return to Mexico for her retirement. And it is one of the things that I had to encourage her not to do because of the cost of care and the quality of care she would have received where she wanted to move back to in Mexico, whereas she fully, after working in the Bay Area at MedApp for 25, 30 years, she was fully covered by Social Security, which is paid anywhere if you want to live anywhere in the world, but Medicare is not. All right, so care delivered outside the United States is not delivered, right? There is no Medicare outside the United States. One thing to think about if you're going to live internationally in retirement. I do have a couple clients that do live internationally. They tend to have homes in California or in Nevada, and they live in countries, it seems like everybody's in somewhere in Central America, whether it be Costa Rica or Mexico or Belize. That's where they've retired, but they do come back at least twice a year for all of their Medicare procedures and everything that they need to get taken care of. That being said, if there's some type of emergency down there, we have planned for emergency medical care or emergency trip back to the United States. But just remember, Medicare does not cover anything outside of the border. Dental care, vision care, hearing aids, cosmetic aids, some of those advanced plans do cover these things. So that's why people are attracted to them. Just remember, you need to do the research on your own and find out what works best for you and your specific situation. What it can cover, full or in part, the deductibles, coinsurance amounts, Part A deductible, hospital costs, the 20% of the doctor's bills, amounts the doctor charges over the Medicare amount. I mean, again, these are all the things that we get good insurance for, is to cover these so we're not coming out of pocket for all these things Medicare does not cover. Again, if you have questions on what I've gone over, you can go back on the YouTube channel and you can slow this down, you can pause it, you can take screenshots, whatever you need to do. But again, this is incumbent upon you to find out what's best for your specific health situation. Prescription drugs, sometimes the deductible, maybe not, depends on the plan. You got to do the research. And most of the cost of certain drugs during the initial period, but not the donut hole. And that's one place that you have to plan to pay out of pocket. So Medicare supplement insurance, just simply private health insurance for individuals sold by private insurance companies, right? It supplements that original Medicare, that left side of that diagram we talked about. And there's federal and state laws that protect you as the consumer and beneficiary as to how they need to be standardized. Most states identified by letters. We don't have to worry about Mass, Minnesota, or Wisconsin. Do not work with Medicare Advantage. So those are the two different, if you recall from earlier in the presentation, we got the one size Medicare Advantage and then traditional Medicare on the other side. Pay the monthly premiums and the costs vary by plan, company, and location, which I stressed earlier. These are examples of the different plans. Again, go back on the YouTube. You can take a screenshot. You can go through this. Most popular plan is F, far and away. G is a close second to C, close third, and it's just based on all the different benefits that the plan provides. Medicare Advantage. This is the other side. This is the non-traditional side. It's the health plan option approved by Medicare, called Part C, as you guys know, run by private companies. Medicare. It's run by, a private company, right? It pays amount for each member's care, may have to use network doctors or hospitals. Plan may include prescription drug coverage. Sometimes they have different extra benefits: chiropractic care, vision, dental, preventative care. So, I think the rise of Advantage plans became much more popular as they add some of these ancillary benefits that are not in your traditional Medicare. Shop carefully. I think that goes without saying. Again, if you need to come back and review this slide, I would do it on the YouTube channel, only because we're time constrained here, but I'll leave it up there for a couple more seconds just so you can screenshot it if you'd like. Again, another slide that I'll leave up for a couple minutes here because I think this is important from the standpoint of what, when you're researching your Medicare Advantage plans, make sure you understand what their rating is, right? You don't want to, it's just like when you go out to a restaurant, you look on Yelp or you look on one of the restaurant rating apps, you're not going to go to a 2-star restaurant. Don't get a 2-star Advantage plan either. Make sure you understand what it is, right? Out-of-pocket spending by healthcare, or out-of-pocket healthcare spending by gender and age. Very easy trend to discern here that, under 65, services still tend to be the majority of what is being spent. As you get towards that 65, 74, premiums tend to be more than anything else. But as you get older and older, it's the services that go through the roof. And most of those services have to do with long-term care. So here's a typical Medicare budget in 2024. Here are your premiums. Remember, these are just premiums. These are not co-insurance or deductibles. These are premiums. So here's your Part B premium. Remember, no IRMAs included in this. Part B premium. Here's your Medigap. So this is your private insurer. So your public is the Part B, 174. That's the government subsidized. And then you have the Medigap and the Part D prescription drug plan. So this would be traditional Medicare. So you're paying $300 to the private and $174 to the public. Roughly $500 annualized times 12 because it's a monthly amount. So you're looking at $6,000 a year. Well, what else are we missing? Well, we got prescription drug out-of-pocket costs, right? That portion that's not covered. The dental out-of-pocket, vision out-of-pocket, although I question some of these numbers simply because, I don't know about you, but my dental out-of-pocket, get teeth cleaned twice. If I have a single procedure, it's way more than $450. Vision, Luckily, I'm still on my Costco slash CVS just readers, just basic readers. I still have good vision otherwise. But I can see how some of you may be in a different situation when it comes to vision. That's obviously, very important. And then alternative care. Some people love to go to get chiropractic work, whether it's, what are they called? The needles. I can't think of it off the top of my head right now. I've done it 1,000 times. Massage therapy, all these different things. But that's a very tiny budget, only $200 annually. That doesn't cover much. And and just to show you there, you're at $7,300 annually, and that is per beneficiary. If it's couple, you're looking roughly $15,000 a year out of pocket. And if you're taking that out of your IRA to pay for that, or your 403B or 457, let's remember that you have to pay taxes first, potentially. So just things to think about when you're budgeting. What can cause your healthcare budget to change in the future? Well, certainly rising healthcare, right? Rising insurance premiums. Let's say the Medicare supplement or Medicare Advantage plans in your area change and the prices go through the roof, similar to how home insurance in Florida is about to go through the roof with 2 consecutive hurricanes, things you can't predict, right? A change in healthcare status may require expensive prescription drugs, and then you have the donut hole that you have to worry about. And then you're looking at different forms of care, whether it's dental, vision, hearing, alternative care, and then specifically long-term care that are not covered by that insurance. So here are a couple sources of and this study is like 10 years old, so this has got to be significantly higher now. But Fidelity concluded $250,000 after tax for couples. The Employee Benefit Research Institute put it right around $300,000. I put it today closer to $400,000 for a couple. And I say $400,000, and remember $400,000, and that is for your lifetime. That's not, you pay that at 65 and you're done. But that's for your lifetime, and that doesn't include long-term care. So it's something you need to think about. You need to, structure your investments, your retirement investments, whether it's your 403B, 457, or an IRA or Roth IRA, or whatever you happen to have for retirement. You can't just sit there in money market because you're retired, because you won't keep up with the cost of inflation, particularly on healthcare and in just consumer inflation at this point. Remember that long-term care is not covered by Medicare or Medicaid, right? There's no coverage after 100 days, and there's no coverage at all with activities of daily living. I said I was going to make a mention. I'm not going to go over the stuff that all the ambulatory stuff and the activities of daily living with long-term care, because that's something that there's a whole nother presentation on. So I'm going to kind of skip through this, but what I will say is when it comes to long-term care, there are different, if you're not someone that wants to pay as you go, meaning you don't want to pay $200 a month in premiums, and you're like, I don't know if I'll ever use it. There are some other types of policies that I really like that have worked well with clients of mine. You can't do it inside of a retirement account, but with the fact that T-bills have paid so well for so long, and now we have the Fed reversing, and now interest rates are coming down versus going up, and you have significant what I call reinvestment risk. There are certain policies out there, long-term care policies, where you simply reposition money. Let's say you have $200,000 in a CD, and you reposition that CD into what's called a single premium long-term care policy. No, it's not $200,000 that goes away, you don't lose it. But you get interest payments on it like it's a CD, and you can go back and get that money anytime you want, sometimes for 10 years, sometimes for 15. And if you go into a long-term care event, it provides you a significant benefit, 2-3x in leverage long-term care. If that's something that you want more information on, send me an email, or ask the person that's doing the long-term care presentation. I think that's really interesting. It's been very interesting for our clients, simply because it allows you to reposition money that's in your portfolio, but always go back and get it back if something catastrophic happens. Or if the person that you thought was going to have a long-term care event passes away, you can just go take that money back. There's a benefit there. So I think that's worth taking a look at for most people that are in retirement that have, a CD or maybe T-bills or something like that. If you have something like that, I would encourage you to find a professional you trust that can walk you through that, because those are seem to have a lot of benefit to them, in my opinion. All right. And again, that's just my opinion. Reminder number one, enroll in Medicare in time. Again, if you take anything away from this, you need to take it. It's incumbent upon yourself to shop carefully for that private insurance to go with Medicare. Make sure you are staying up with that on an annualized basis, or annualized rate. I should say this is the time of year, September, October, November, when you need to be doing your research and getting into either a new plan or sticking with the one you have. Plan for higher healthcare in retirement, for sure. And that is the end of today's presentation. I don't see anything in the chat. I will stay here for, let's call it 2 minutes. Ariana, if you want to come on as well and if you want to put in the chat where they can find the YouTube channel so they can replay this at their own leisure, that would be wonderful. If you are living abroad, do you need to apply for Medicare? That's a great question. Gosh, Yuri, you give me some tough ones today. Or excuse me, Yuki. That is one I have not had. And that is a great question because if you ever come back, you'd be subject each year you're gone to a 10% penalty. I would call Social Security Administration and ask them that question. They may tell you yes, because if you ever return, you're going to have a penalty, but you may say, I'm not coming back. And that's fine. That's totally up to you. But that's a great question. And if you don't mind, if you want to send me a personal email, I'd be happy to I have a source that I go to for all those questions. I'm happy to ask that question for you if you would like me to. But that's the first time I've had that question. I appreciate that question. Thank you. Always get stumped once in these lectures.